Is there a tear size where you'd shorten the conservative treatment period?
If we're already seeing that the tear is already retracting and it's getting close to the joint itself, where it's going, it's retracting like a rubber band and getting smaller and smaller. If it's getting too small, where it's on the verge of being irreparable, and often that goes hand in hand with significant weakness, then at that point we may have a conversation, say, look, it's getting kind of close. We can try a little bit of conservative treatment. I'm totally okay with that. I encourage it most of the time. But we have to keep a very close eye on this, because if it gets much bigger, this tear, then we won't be able to repair it and our window of opportunity will be lost.
What happens to a rotator cuff tear if someone ignores it entirely?
So the studies have shown that very, very often, especially if there's already weakness, a rotator cuff tear will retract, will start atrophy. It'll start getting smaller. And the amazing thing is that that tendon starts converting into fat. Much of that tendon no longer is a tendon, and literally is replaced by fat. And fat cannot be repaired. It cannot raise your arm. It cannot be a tendon. It can't function as a tendon. So that's the potential natural history of a torn tendon. It does not happen to everyone. It is less likely to occur in a partial tear, but the possibility of that happening does exist in everyone with a tear, with a rotator cuff tear.
Is there a point of no return where the tear becomes irreparable?
Yes. If the tear reaches a level where it's beyond the joint, so the joint is somewhere at this level here. It's hidden behind the subscapularis tendon, but it's in this area here. So if this tendon tears and starts atrophying and retracting, if it reaches past this level, the likelihood of repair is very small. But sometimes what we can do is we can bring the infraspinatus up from behind and try to cover this area and kind of function as both the supraspinatus, infraspinatus. Sometimes we can bring the subscapularis up. We can do what's called a partial repair. And very often that actually is very effective, especially if it's a low demand patient, where doesn't do a lot of heavy labor, doesn't do a lot of sports. It's just a matter of function every day. So for those patients, sometimes a partial repair is very, very effective.
Give me a second, we lost balance. How quickly can a tear progress from repairable to irreparable?
It depends the type of tear. If it's a degenerative tear, it may take months or years. Probably not so much years, but it can reach that level. Partial tears may take months or years. Acute traumatic tears do not. Acute traumatic tears retract and atrophy at a very, very fast pace. So that may take sometimes weeks, sometimes a couple of months. And that's why we have to keep a very close eye on those kind of tears. That's why for those kind of patients, ultimately surgery is probably the most conservative direction in preserving the joint.
What are the surgical options when a tear is irreparable?
So if it reaches a stage where it's irreparable, you have a couple of options. One, you can still make an effort to repair the tear. You can use a partial repair where you can bring some of the other tendons over and have them help in the function of the torn tendon that's no longer repairable. And now you can use synthetic patches that are made in the laboratory, and we can put it in and replace the missing portion of the tendon. And that's showing some very, very good results. Ultimately, if none of those are an option any longer, you can have a shoulder replacement surgery.
What does quality of life look like for a patient with an irreparable tear?
So that's really the focus for us, for orthopedics in general. That's one of the major focuses, is quality of life. So if it reaches a stage where the rotator cuff tendon is irreparable, where the tissue is essentially retracted all the way, there's only just fat left, very little tendon left, and there's just bone there. Now you have the tendon that's between the two bones is gone. Show that picture again. So now this tendon here, that's between this bone and this bone, this tendon here is between this bone and this bone is gone. Now this bone starts moving higher up and rubbing against this bone. It's called rotator cuff arthropathy, which is essentially a form of arthritis. These patients very often will have significant weakness. It'll be difficult for them to raise their arm much more than this. They won't be able to do this. It kind of just stops like this. They have constant pain at night. The function of that arm is essentially almost lost, and it's a very, very difficult way of life for them to accept, for anybody to accept.
What is your philosophy when a patient comes in with a rotator cuff tear?
My philosophy for every patient is preservation. My responsibility is to preserve your joint. You come in with a problem, my goal is primarily to make sure that I do what is necessary to make sure that joint is its optimal preserved state so that you can have it functioning for the rest of your long life. So it could be, if I'm seeing someone with a meniscus tear, ACL tear, slap tear, all injuries. In the case of the rotator cuff, it's really to make sure that the situation is not amenable to the tendon tearing further, retracting, or reaching a stage where the tendon is not repairable and the weakness is present. So that's the goal, is to make sure that the tendon continues to function, your strength is maintained.
What do you want the patient to leave the consultation feeling?
Informed of the facts, informed of the truth, and informed of all options.
What is the one thing you want every rotator cuff patient to understand before any decision is made?
I want to make sure everybody understands their options for any condition. There are almost always options. And if there aren't options, then you should be made aware. But not everybody knows what their options are until you speak to someone that is willing to give you all the options. If you've been told you have a rotator cuff tear, come in and get all your options before committing or rushing into surgery. And definitely don't dismiss it entirely. At New York Bone and Joint Specialists, we have the elite experts to give you all your options and treat you with all options available. We are here for you and we care. Please contact us. And to allow us to reach more people and help more people, please like and follow this video. Thank you very much.